Have you ever wondered how hormones like estriol and progesterone can help protect or fight breast cancer? In this blog post, we will discuss the various benefits of natural bioidentical progesterone in terms of preventing and fighting this type of cancer. We'll start by looking at why hormone balance is so important for good health before exploring the effects that taking bioidentical supplements has on reducing your risk. Lastly, we'll look into research regarding using estriol for treating existing cases as well. So come with us to learn more about the protective powers these estrogens possess. Understanding estriol and natural progesterone. Estriol and natural progesterone is a hormone that has been associated with breast cancer prevention. Estriol is an estrogen hormone that occurs in smaller amounts compared to other estrogens, such as estradiol. Natural progesterone, on the other hand, plays a significant role in keeping menstrual cycles healthy and regulating fertility levels. Additionally, it works like armor against certain forms of cancer, including breast cancer. How remarkable! In recent years, a lot of research has been conducted to explore the potential medical applications of hormones. It appears that they can be used as an effective tool in reducing the chances of developing breast cancer or managing existing tumors. Estriol is one such hormone that prevents some forms of estrogen from stimulating its receptors and consequently minimizes the risk of people having positive results with regards to estrogen tests being diagnosed with breast cancer. On similar lines, natural progesterone plays a role in lowering levels of circulating estrogens, thereby helping out those trying to beat off existing tumors by controlling their substance levels. So far, it seems like using the hormonal treatments might prove beneficial. However, more extensive studies need to be carried out before drawing any conclusions in this regard. It appears that estriol and natural progesterone have both been explored to understand their possible benefits in fighting existing tumors as well as preventing new ones from forming. For instance, a particular study established that women who had raised levels of estradiol were more prone to death when compared with those having lower levels. Nevertheless, when these ladies were provided with both treatments, i.e., the combination of estrogen replacement therapy alongside progesterone alternate therapy, they experienced remarkably low mortality rates due to decreased chances for all types of cancer, including breast cancer. Could it be because this form of treatment stimulates something within our bodies, perhaps naturally generated immunity? Recent research discovered that postmenopausal women who received both estriol and progesterone reported fewer menopause symptoms, such as hot flashes and night sweats, in comparison to the group that took either one of them or none. In addition, this combination appears to carry some other potential benefits too. It could help reduce the risks associated with different types of cancer, like breast cancer, while also improving bone density levels and decreasing inflammation throughout the body, all of which can lead to better health outcomes eventually. What's more, natural progesterone is believed to boost mood balance, providing support for regular sleep patterns, especially beneficial during the menopause stage when changing hormones affect their restful sleep cycles, causing tiredness at daytime due to a lack of proper rest overnight. Estriol benefits for women's health. Research suggests that estriol, a hormone naturally present in our bodies, can provide women with numerous benefits. It is one of the 3 big estrogens produced by the ovaries and placenta during pregnancy. Over time, people have used it to effectively treat menopausal symptoms such as hot flashes. What's more, evidence even shows its ability to protect against breast cancer when combined with natural progesterone. How exciting! Back in 1975, research revealed that postmenopausal women who had been on estrogen replacement therapy for more than 5 years were more likely to get breast cancer. That was when the link between hormones and breast cancer first began. Since then, a lot of studies have looked into different types of hormones and their effects on either developing or intensifying existing cases of breast cancer. One particular area that researchers concentrated on was bioidentical hormone replacement therapy. This kind of treatment uses identical duplicates: estradiol, progesterone, and testosterone, as those naturally produced by our body's own system. This type of therapy is different from ERT as it uses smaller doses for a shorter period. And this could help decrease the side effects that can come from the longer-term use of synthetic hormones, such as those used in ERT. Recently, breast cancer research published an interesting study that suggested that taking a combination of estriol and natural progesterone might protect premenopausal women against breast cancer, or at least slow down any progression if they already have it. The study revealed that when both of these hormones were taken together, even if their levels weren't optimal, they could potentially lessen tumor growth. This implies that using bioidentical hormone replacement therapy may be beneficial in decreasing the risk or delaying progression for premenopausal women who are at higher risk due to genetic elements or environmental exposures. While more investigations need to take place before any decisions can be made concerning how estriol and natural progesterone might aid in preventing or combating breast cancer, this news is encouraging for those looking for non-traditional treatments rather than conventional alternatives such as chemotherapy or radiation treatment. As usual, it's always best practice to consult your doctor prior to starting off on any new remedy program. The role of hormone balance in breast cancer prevention. The importance of hormones in preventing breast cancer is undeniable. In the past, doctors thought that genetics and environmental circumstances were primarily responsible for causing this type of cancer. However, new studies demonstrate the huge role hormone balance has to play when it comes to whether or not a woman develops it. Hormone imbalance can be caused by several factors, including age, stress levels, diet, and lifestyle choices like smoking cigarettes. These all have an impact on how much estrogen gets produced, which could ultimately lead to a higher risk factor for developing breast cancer. When it comes to breast cancer, estrogen is the main hormone that plays a big role in its development. That's because it encourages cell growth and division, which then increases the chances of mutations occurring, something that could end up leading to malignancy. Fortunately, estriol, a type of bioidentical estrogen, has been found to be great for reducing this risk as it slows down cell proliferation rates while also decreasing inflammation within cells, potentially protecting us against certain kinds of tumors developing. What's more, these benefits are not limited to just prevention. If you have already developed breast cancer or other related diseases, estriol can still offer relief from symptoms by minimizing side effects and improving quality of life overall. Natural progesterone has been discovered to be beneficial for reducing the risk of developing this type of cancer. It works by counteracting some effects caused by high estrogen levels, such as promoting cell growth and division, while simultaneously stimulating apoptosis HL death. Not only does it help prevent new cancers from forming, but estriol and natural progesterone have both proven effective in fighting existing tumors too. This is really encouraging news that can give us hope when faced with a serious illness like cancer. Research has indicated that these hormones have the potential to impede tumor growth and stimulate apoptosis in cells, causing them to die faster than normal. This makes them an ideal option for those with cancer who are looking for treatments outside of chemotherapy or radiation therapy, as they tend to provide fewer side effects while also possibly enhancing effectiveness when used together with other treatments rather than relying on one single treatment method without supplementing it first. Rhetorically speaking, could natural hormonal therapies be a viable alternative approach? Correlation between natural estriol and breast cancer risk. When it comes to breast cancer, many women are trying to find natural ways of protecting themselves and decreasing the probability of developing this disease. One potential solution could be supplementation with natural estriol and progesterone. Estriol is a type of hormone estrogen that can be found in the human body naturally. Moreover, research has proven that higher levels of estriol may protect against breast cancer development in postmenopausal ladies who have a lower risk of developing such a condition compared to others who don't possess elevated levels. Is there something else we should know about protecting ourselves from breast cancer? Aside from its defensive properties, estriol also plays a role in regulating other hormones such as progesterone and testosterone. It's been found that when these hormones are out of whack inside the body, it can cause cell growth to go up, which may increase your chances of getting breast cancer through supplementing with natural estriol. Though this hormone imbalance could be fixed, leading to less cellular growth, something that results in lowering your risk factor for developing this illness. So why not make use of a simple remedy like taking an estriol supplement? Moreover, research has suggested that combining natural progesterone with estriol can provide more protection against breast cancer than either hormone taken alone. Progesterone aids in neutralizing estrogen's effect on cell growth. Thus, taking the two hormones together may offer even better gains compared to one of them alone. In addition, studies have demonstrated that when combined, they not only diminish the chance of this condition but also help boost general well-being by decreasing symptoms such as hot flashes or night sweats associated with menopause and aging processes. Does this mean women already going through these health issues could benefit from using both bioidentical estriol and natural progesterone? It appears so. Supplementing their use looks promising for those looking to reduce the risk of getting breast cancer while providing additional support during treatments like chemotherapy or radiation therapy. How bioidentical progesterone can fight breast cancer. Bioidentical progesterone is a hormone naturally produced by the female ovaries during the menstrual cycle. Its primary purpose is to prepare and support the uterus for potential embryo implantation, which in turn makes it essential for a healthy pregnancy. But that's not all. Progesterone also plays an important role when it comes to breast cancer prevention and treatment. Its ability to balance estrogen levels helps reduce the risk of this illness or can improve the outcomes of women who are already diagnosed with this disease. So far, progesterone has been used as part of conventional treatments for breast cancer. But now there's something new on the horizon, bioidentical hormone therapy. This type of alternative approach brings many benefits, such as fewer side effects compared to traditional therapies, while still providing the desired results. Bioidentical hormones are something special. They come from natural sources such as yams and soybeans and can be customized to fit each patient's unique needs. This makes them much safer than synthetic hormones, which could cause side effects like headaches or nausea for some people out there. But the use of bioidentical progesterone in relation to breast cancer is quite new. However, studies have suggested that it does deliver good results in certain scenarios. Take, for example, a study that found that women with high estrogen levels who were given bioidentical progesterone had lower recurrence rates than those who weren't. Another study discovered encouraging tumor responses after 6 months of follow-up care in those women receiving BRT, bioidentical hormone replacement therapy, compared to the ones not treated this way. Adding on to natural hormone therapies such as these, bioidentical estriol could be beneficial when used alongside progesterone, protecting against breast cancer development or progression altogether. Estriol works by blocking estrogen receptors on cells, thus reducing their activity level, which in turn lowers the risk factors connected to certain cancers that are dependent on estrogen, like breast cancer. On top of its anti-cancer properties, estriol can also be used to provide other benefits such as helping build up bone density, elevating libido levels, improving vaginal health, and decreasing menopausal symptoms. Although there is no definite proof that bioidentical estrogen and progesterone can prevent or cure breast cancer, there is still some research indicating they might be helpful when employed together with other treatments, for example, chemotherapy or radiation. Women who contemplate using these hormones should go over all options thoroughly with their doctor prior to beginning any new treatment plan. Using natural bioidentical progesterone as a preventive measure for many years. Natural bioidentical progesterone has been used as a preventive measure for women and is becoming increasingly well known due to its potential benefits. Progesterone plays an important role in controlling hormones and keeping the balance of one's body intact. Additionally, it's believed that by curtailing overproduction of estrogen can cause cell growth. Progesterone could potentially safeguard against cancer, especially breast cancer. Research also suggests that this hormone might reduce inflammation, which would prove beneficial to those with or at risk of developing breast cancer. What other ways does our body benefit from having optimal levels of progesterone? Apart from potentially protecting against breast cancer, natural bioidentical progesterone may be beneficial in relieving menopausal symptoms such as hot flashes and night sweats. This hormone replacement therapy, HE, also known to help ease other signs like mood swings or anxiety caused by hormonal imbalances triggered by the menopause, progesterone has a soothing action on our body, which can be very useful in cutting down stress levels at this stage of life changeover. Have you ever heard about how it helps? It looks like this product might help with protecting against osteoporosis, which is especially important as we age. Bone density tends to decrease naturally over time, and this may be one way to keep it at a healthy level. Is there another option other than taking supplements? I'm sure there's research out there that could provide more information on the matter if necessary. It's a must to bear in mind that while natural bioidentical progesterone may potentially give some advantages for health, if taken as prevention or during menopause, it should not be used without speaking with your doctor first regarding proper dosage. And any potential interferences with other medicines you take at the same time or when there are underlying issues that can influence how your body responds to this kind of treatment. Moreover, if you are pregnant already or plan on being so soon, you should avoid ATI until after delivering because, even though it is considered safe, otherwise under medical supervision, taking it might incur risks connected to pregnancy. Case studies on the successful use of hormones for prevention. It is definitely true that bioidentical estriol and natural progesterone are both useful for preventing and combating breast cancer. Estriol is a type of estrogen that naturally exists in our body, while progesterone acts as an important balancing agent against the impact of too much estrogen. Various studies have been conducted on these two hormones, with concluding results indicating lower instances of breast cancer if used together properly. It's interesting how these particular hormones can help protect us from what could be potentially serious conditions. It really helps support the idea that sometimes we need nature-derived solutions when looking out for our health. Research indicates that women who choose to utilize bioidentical estriol and natural progesterone are less likely to contract breast cancer compared to those who do not. Moreover, it has been discovered that these hormones can minimize the risk of recurrence in women with a history of this disease. Interestingly, studies have also suggested that by utilizing bioidentical estriol and natural progesterone, individuals may experience some relief from various symptoms associated with menopause, including hot flashes, night sweats, and mood swings. Furthermore, vaginal dryness, which is often caused by low levels of estrogen, might be alleviated too. Would taking such things really help us combat all sorts of menopausal ailments? Women who are looking for ways to manage their menopausal symptoms without resorting to hormone replacement therapy may be drawn towards bioidentical estriol and natural progesterone. This is because several studies have shown that this combination can be used successfully in tackling breast cancer, prevention, or even fighting against it at times. To illustrate, one particular study reveals that when premenopausal women were given a blend of these two hormones along with the analog of human estrogen known as bioidentical estradiol, They had fewer cases of developing such a condition after 5 years than those who only took placebo treatment during the same period. Additionally, another study was conducted that considered postmenopausal participants taking equal amounts of the combination. Results showed a dramatically lower rate of new tumors among them compared with those receiving placebo alone throughout the 4-year duration. These trials not only show us how well bioidentical estradiol and natural progesterone can work if we want to reduce our risk of getting breast cancer, but also ensure safety by monitoring closely under medical supervision. Why don't you give it a try? Misconceptions about hormonal therapies in cancer prevention. Misconceptions about hormonal therapies for cancer prevention are quite common, even among people who have a good understanding of medical science. Take estrogen replacement therapy as an example. Many women know it carries the risk of leading to breast cancer, yet they often overlook that there also exist safe and natural alternatives to ERT that can help reduce the potential danger of developing such a condition or combat existing malignant cells in their body. But how do these alternative therapies work? An alternative that has some potential is bioidentical estriol. It has been discovered to have many anti-cancer properties when taken with natural progesterone. Estriol is naturally produced by a woman's ovaries, and it looks like it could block certain cancers, including breast cancer. This blocking happens because of the estrogen receptors on tumor cells. They can't grow or multiply if those are blocked off. Plus, this special hormone helps give your body an immune boost so you don't get sicker from any existing tumor cells in your system before they spread further around elsewhere in the body. Who wouldn't want something so marvelous? Apart from its anti-cancer benefits, estriol is also very effective in treating menopausal symptoms, as it can replicate the functions of hormones like estrogen and progesterone that naturally occur within a woman's body. This makes it an attractive choice for postmenopausal women who are looking for ways to get relief from hot flashes or other commonly associated problems related to the change without having to rely on more extreme measures such as hormone therapy or surgeries. Adding natural progesterone, another female sex hormone produced by the ovaries, along with bioidentical estriol, provides great protection against breast cancer due to their combined action inside your system. Estrogen mainly works towards cell expansion while progesterone controls cell division. Together, they create a barrier around cells so only healthy ones find their way into new tissues, whereas malignant cells cannot spread throughout your entire system. Future perspectives on using estriol and progesterone against breast cancer. There is an increasing curiosity about using bioidentical estriol and natural progesterone to treat or avoid breast cancer. Estriol, a weak form of estrogen, has been looked into for its cancer preventive abilities, while progesterone, known for protecting against the disease, has the capability to provide a more secure and all-natural option of hormone therapy than traditional options used in treating this condition. Research indicates that estriol may inhibit tumor growth in certain organisms, as well as lessen inflammation within the human body. Does it mean we can increase our chances of finding better treatment by utilizing these hormones? Furthermore, it looks like estriol has an anti-angiogenic effect, meaning that it aids in taming the growth and formation of new blood vessels around tumors. This could be a huge help when aiming to shrink tumor size or even maximize results from therapies such as radiation therapy and chemotherapy. Research suggests that estriol can also diminish certain cancer risk factors, including breast cancer development. On top of this, progesterone has been studied for its ability to defend against developing or recurring breast cancers too. How amazing is that? It looks like this hormone can possibly block some estrogen receptors on cells in the body. This would keep them from becoming overly stimulated by too much estrogen, which could result in tumors forming within the cells of our breasts or other areas of our bodies. What does that mean for us? Is there a way to use it as a preventative against cancer? These are important questions that should be explored. Furthermore, progesterone's anti-inflammatory properties are believed to help reduce inflammation caused by certain forms of hormone therapies, which could prevent recurrence after the end of treatment, as well as improve overall health outcomes during treatments involving other drugs like chemotherapy or radiation therapy used in conjunction with it when treating particular cancers affecting women, such as breast cancer cases. Therefore, there is much evidence suggesting that bioidentical estriol and natural progesterone can work together synergistically when properly included in prevention and after treatment plans for various types of female-related cancers, including those regarding breasts, due to their ability to stimulate cell death while also being able to decrease inflammation all at once. Additionally, they may be able to block some receptor sites from becoming overly stimulated due to high levels of estrogen found naturally within a human body, therefore aiding balance hormones present throughout the entire organism, so any combined effects either one may have on its own will be even more powerful working side by side than if consumed separately under same conditions, ultimately making them viable options. Future research providing secure yet efficient solutions combating issues linked to specific malevolent tumors and connected problems associated with females, particularly dealing directly with related chests, definitely demands further analysis down the research road with the potential to deliver greater rewards later, potentially assisting numerous ladies out there who now suffer having to handle situations presently too. Final takeaways and frequently asked questions. There are many questions regarding breast cancer and the best way to protect ourselves from it or fight against it. Two of the most commonly used treatments for this serious disease are bioidentical estriol and natural progesterone. Many wonder if these two can aid them in combating this illness, so let us examine how they could be utilized together as a team. Bioidentical estriol is an estrogen form made naturally by our body. What kind of incredible power does that give us? Natural progesterone also helps balance hormone levels when administered properly. Both substances have the potential to help those struggling with breast cancer find relief. It's been proven to help reduce levels of estrogen in postmenopausal women, thus lowering their chances of encountering breast cancer down the road. Estriol also acts as an anti-inflammatory agent, which works against inflammation all over our body and may even protect us from other forms of cancer. Natural progesterone is something that exists within us naturally and plays a key role in ensuring proper balance between hormones inside us. Have we ever stopped to consider what kind of difference this can make for our well-being? It works in a very simple way. It reduces the levels of estrogen while increasing progesterone. This helps support healthy growth and regeneration of cells throughout our body, including our breasts. It also acts as extra protection against abnormal cell growth that could lead to cancerous tumors forming. Something we really don't want. How does this work? Is there any guarantee to prevent potential cancers from developing? When considering the use of bioidentical estriol or natural progesterone for breast health, it's important to keep in mind that they both have been subject to extensive studies with regards to their effects on this area. First off, bioidentical estriol has been found safe when used under medical supervision, and you should always consult your doctor about any side effects or interactions with other medications before taking them. Similarly, natural progesterone seems to produce fewer adverse reactions than those synthesized versions. However, again, caution is essential, as only a physician can advise what would be best suited according to each individual case. These treatments may not just help prevent, but also treat certain types of breast cancer by helping to rebalance hormone levels, which means less inflammation inside our bodies. If either one or both is right for you, then make sure your healthcare provider tracks all progress closely so that depending on how your body reacts over time, dosages can be adjusted accordingly, thus maximizing the potential benefits of the treatment program involved. To sum up, bioidentical estriol and natural progesterone offer interesting prospects towards the prevention or treatment of various conditions concerning the breasts. But since some risks associated with them must be taken into account, it is necessary to first consult a specialist before deciding if these substances are suitable for patients' needs or not. In conclusion, estriol and natural progesterone are powerhouse hormones with a range of health benefits, including those related to breast cancer prevention or treatment. Estriol brings down inflammation, while bioidentical progesterone helps maintain healthy hormone levels in the body. Together, they can work towards promoting good health as well as aiding in preventing or treating breast cancer. If you have an understanding of the advantages provided by both estrogens and natural progesterone, it will equip you to make informed decisions concerning your health care, which could stop breast cancer from taking root within your system. Do not hesitate to get in touch with Pharmaprodia, Compounding Pharmacy today, and talk to Dr. Richard Nkwenti, a compounding pharmacist, integrative medicine doctor, functional medicine specialist, and hormone restoration expert. His expertise is remarkable. He has the unique ability to provide tailored recommendations for every patient's individual needs. He genuinely desires for people to achieve optimal health through medication therapies that combine both traditional medicines as well as alternative remedies, which makes his approach quite comprehensive. With his skill set in customizing medications according to one's specific requirements, you can be certain that your patients will benefit from increased overall wellness and improved quality of life when using these personalized treatment plans designed by him. So do not wait around any longer. Get connected now.